vaccinations for the coronavirus being rolled out in countries like the US and the UK, concerns are rising that South Korea is lagging behind in the procurement of the vaccines. Prime Minister Chung Se-kyun says the nation may be able to start inoculations from February next year. Here's more.
Prime Minister Chung Se-kyun said the Ministry of Food and Drug Safety will likely approve the use of a vaccine produced by AstraZeneca in South Korea early next year. The ministry is now verifying the clinical trial details and efficacy of the AstraZeneca vaccine. The Prime Minister predicted the first batch of doses would be available in the first half of next year, and therefore vaccinations would begin in phases as early as February or March at the latest.
우리는 2월부터 시작하고 싶은 것이고 그런데 2월이라는 약속을 아직 하지 않았기 때문에 3월이 될 수도 있습니다.
However, South Korea has not yet obtained agreements from other pharmaceutical companies, including Pfizer, Moderna and Janssen, that they will supply shots in the first quarter. The government said it is nearing contracts with the three drug makers. Therefore, South Koreans will unlikely receive shots produced by the three firms in the first quarter of 2021. Chung explained about why the nation is lagging behind in the procurement of COVID-19 vaccines. He said when the government launched a task force on coronavirus vaccine procurement in July, the number of domestic daily infections stood at around 100. Therefore, it did not think at the time that it was necessary to rush procurement. Chung explained the US and the UK had to run the risk and pay expenses for developing coronavirus vaccines, as they have been suffering from a staggering number of infections and casualties. He added the contracts the countries had with the firms could only be different to Korea because vaccines were their priority.
확진자가 엄청나게 많은 나라들은 사실은 방역으로는 어떻게 할 도리가 없는 상황이기 때문에 백신의 의존도가 굉장히 높아질 수밖에 없죠.
Chung acknowledged that the ultimate solutions to battling the pandemic are effective antivirus measures as well as treatment and vaccines. He also expected a domestic pharmaceutical company to produce a homegrown vaccine late next year.